Hello and welcome to episode 56 of the Climate Skeptic podcast. I'm your host, Toby Young. Professor Carl Heneghan emerged as a bit of a hero during the pandemic, challenging the government's official data at every turn and questioning the wisdom of the lockdown policy. Last month, on Trust the Evidence, the Substack he co-authors with Tom Jefferson, he questioned the UK Health Security Agency's claim that the heatwaves in May and June have caused 2,877 excess deaths in England and Wales, pointing out that it isn't based on observable deaths, but on modelling. Carl joins me now from his home in Oxford. Carl, thank you very much for joining us today.
You're welcome. Nice to speak to you and see you again, Toby.
So what I wanted to talk to you about is you and Tom Jefferson have written a couple of posts now on Trust the Evidence, casting some doubt on the figures produced by the UK Health Security Agency about the number of heat deaths that can be attributed to the heat waves of May and June. Do you want to tell us why we should treat those claims? I think they claim something close to 3,000 heat deaths. Do you want to tell us why we should treat that claim with a pinch of salt?
Well, you're right. The claim is, if you look at the headline, which UKHSA put out, they say the report shows 2,877 excess deaths were caused by May and June heat waves. Now, that was reiterated by organisations like the BBC, The Guardian, and if you looked at that, you'd think it was a directly inferred fact. But actually, these are estimates generated by statistical models. And though they are being interpreted as though they are directly observed facts. Now, this is important. You use models to set hypotheses, to set directions of effect. So it's okay to use a model to say, when actually it gets above 30 degrees C, more people might die, and here's what they may die of. In doing so, you should be prepared. But what's happening is they are being transferred into facts, and they're not facts. And in fact, even the ONS, when they put its data out, says, look, there's a problem here because we still don't know what's going on because we haven't had all the deaths reported and they're not all in on the date. So there are provisional estimates based on something called heat attributable deaths. You make assumptions that on a hot day, this is what you think happens. Now, importantly, none of this tells us how many people directly died, which of those were avoidable. So we're not here arguing that some deaths occur in the heat. I mean, look at the problems we've had with deaths from drowning. Substantial number of avoidable deaths occur from drowning, and there are millions of people, millions of children who can't swim. So there are deaths that occur when it's in a heat wave position. But the important issue is, what is actually, are people dying, say, for instance, because they're very elderly, frail, and the death is brought forward by 4 hours, for instance? That's important to know that. So who are dying? What is the age of those dying? And importantly, in doing so, if we start to look at the ONS data, actually, it's nothing compared to winter. We should be far more worried about what's ensuing in winter with the excess deaths when they get into 4,000 or 5,000 a week extra deaths than what we're seeing now. So the main issue here is the way the narrative is being betrayed, the way the story is being told, and the way people are being misled by the headlines, which are to draw people in.
Will we know more? Will we be able to treat claims about excess deaths due to the heat waves of May and June and now July? Will we be able to treat them as a bit more reliable in due course? I mean, is this something that can be resolved over time when we have more data? Or is there always going to be some doubt as to how reliable these claims are?
You know, in this modern world, we're drowning in information, we're drowning in data. And one of the big issues we have is nobody actually wants to do what you say and say, like, let's do a thorough investigation into what's driving deaths, if there are excess deaths in heat waves. And in doing so, what will happen is in about 6 or 9 months' time, the ONS will produce a yearly report. We won't be able to tell much from that because it'll be just accrued based on age, maybe a bit of sex, maybe a bit of gender, and maybe a bit of certain conditions, but we won't be able to tell very much. Look, at the moment, we have a real problem with most of our data systems across all areas of government and healthcare. We're drowning in information, and people aren't doing the precise job to work out what is causing these deaths. So it's not just the data. If you really want to understand, you have to go back to the original medical notes. You have to do a field investigation. You have to get your hands dirty and go out there and work out what's going on. I think this is an important piece of work to do. But actually, at the moment, we seem to be fixated on people sitting behind their computers, just looking at poor quality data, producing models and assumptions. And I think there's a real crisis right now in our interpretation of data and how it informs healthcare. Because importantly, the first question you want to know is if you're going to pursue this, you're looking into what can we do differently to improve health outcomes. And I think that's an important question to ask. But to do it, it's a combination of, yes, the data, but it's a combination of some field work. And that bit is now missing in what I call epidemiology, because it's just far too easy to jump on a computer, produce a graph and put a paper out there and think your job's done.
So your objection to the UK HSA's headline claims isn't that they are demonstrably false. We don't know whether they're false or not. It's that they're making these claims with a bogus degree of certainty, and they're not acknowledging, certainly not in the first few paragraphs, that they are based entirely on modelling rather than observed deaths.
Correct. You could give me a number of 3,000. You could have told me 4,000. I mean, the first thing is to say, who would give a precise estimate without actually giving you some range? That for readers is a number one sort of signal to go, there's an issue here with the data. Now, if they said, it could be somewhere between 500 and 3,000, you might go, okay, there's a range. It probably does fit in there in some way. Will we get to the truth? Probably not. We can produce an estimate. But you're right. It's the way they're being reported. And the problem is we're seeing this predominance that supports a certain narrative. So papers are rushed out, not peer reviewed. They're always at the bottom of it. It says, this is provisional. It's got lots of assumptions or lots of problems. But if you go to the top, the headline style is 2,877 people died because of the heat. Now, compare this to what I consider is the more technically precise way of saying that. UKHSA has produced a provisional statistical estimate that 2,877 deaths were heat associated during the May and June heat episodes. The estimate will be revised when complete mortality data become available. Now, that's the truth, but the headline just draws you in to say people are dying because of the heat, and that is the problem we face, is the way headlines are derived, the way press releases are put out there is misleading. People
in my camp, climate contrarians, when they see headlines like that, imagine that the UK HSA has signed up to a kind of climate alarmist agenda, and they're singing from the same hymn sheet as many other government agencies and politicians and officials. But do you think that is essentially why they're framing this in that way? Or are they just simply trying to generate headlines and press coverage because, there's a value in that in their eyes in its own right, regardless of what agenda it promotes?
So I think let's start with the last. I think there is a sort of way of that, the way we garner impact from UKHSA or Imperial produced a model is we get to the press. I think the smart people know actually this headline is what will generate attention. That'll get picked up. We have to write it in a certain way. You write a bland, boring headline. This is all a bit uncertain. It's all based on estimates. It's going to get lost. My second point is I think there's a predominant mode of operating now, which is a marketing tactic, which is based around fear. And, you look at it, fear is used in so many ways now to then try and get you to do something differently or believe some ideology, but the problem is this fear, if it goes too much, might say, well, actually what you need to do is put air conditioning in every house and every hospital. Well, how will the net zero people feel about that? But your third is, I do think this is a crisis for academia, is our job is to test hypotheses. and in doing so to try and test a null hypothesis. And that requires a level of skepticism which is more than what you operate in your normal life. And what I see is, unfortunately, is people have certain ideologies and they think their job is to produce research to support that ideology. And I see is that's the mode of operating with social media, the contract. People are worried about cancelling if they don't follow the doctrines of the day. And I would say your notion is that things are inherently much more complex. And if you want to get to the truth, you've got to reflect that complexity and you've got to act with much more uncertainty. Now, you know, my day job is professor of evidence-based medicine. You'd think it was the most uncontroversial thing in the world. But when you walk into an arena where people have opinions or ideology and you say, well, look, here's the evidence, and start asking questions, people feel uncomfortable. And with that comes a sort of a way of thinking that actually is difficult to disentangle. And I think what we're really asking for is high quality evidence to reduce our uncertainties. Beware of people who say things are certain. And I think that's the huge issue in this modern, is people are proffering uncertainty when it doesn't exist. There's a lot more uncertainty. Our job is to reduce that uncertainty. That's the job of research.
Let me ask you about another topic, which is the recent downfall of Anthony Fauci. And it's become clear, if it wasn't clear already, it's become clearer still in the past few weeks, that he made various claims in his capacity as a government science officer that he didn't at the time believe to be true. So he wildly underplayed the likelihood that SARS-CoV-2 had leaked from the lab in Wuhan. He made the case for the 6-foot social distancing rule without ever having any evidence that that was actually going to prevent infection. And he exaggerated the efficacy of the COVID vaccines and underplayed the risks. Have you been surprised by any of those revelations? Have you looked at Fauci's diaries?
Yes.
Have you been following the congressional hearings?
So the first thing that surprised me, Toby, is the fact that that is actually come to the fore, that actually has been put on a pedestal and has been pulled apart in a way that I don't think I even considered would ever happen. If you go back in 2020, 21, anybody who was questioning, and I wrote an article in The Spectator, me and Tom Jefferson wrote an article about there's no evidence for the 2 meter or the 6-foot rule, and basically got complaints about my university saying you should be thrown out of your job. And the idea now that he's on the stand and being asked questions about his areas where he went into. And again, what he did is he made statements of certainty when it didn't exist. So a classic one I think he made was vaccines are the dead end for the virus, which was never true because even Pfizer said we didn't study transmission in the trials. So he was making statements that were factually incorrect. And then I think the interesting issue is that actually it's not that he made statements that were incorrect. He knew they were incorrect. I can't reconcile that. But one of the important issues here is, look, we just wrote a piece about health secretaries. I mean, look, I listened to the health secretary today, Yvette Cooper. I thought she can't know much about health. She's only been in the job a few days. People can't even name the last one. James Murray, who disappeared. There's been 10 in the last decade, just over. They come and go so quick. So actually what we understand is the people making decisions, like in the pandemic, the advisors are incredibly influential in the direction of travel because our ministers cannot know enough to be able to question and understand the science of the evidence, to be able to say, do you know what, I quite like to look at it myself and come to my own conclusions. They rely on their advisors. So here's what I think would help the UK right now, is if we could adopt something like the Senate committee hearings. Our COVID inquiry has been a waste of 200 million and has not addressed the real issues, and get the people who are advisors up on the stand and get ministers who want to question them in a way to say, in this country as well, why did you offer certainty when actually it didn't exist? Why in the background, I suspect if they had their public information and you did the thorough job, you'd be able to say, look, actually there's a real problem here in those people who advise governments and provide certainty. And when we understand that, as we do for like maths, we understand the reason we mask children is to please Nicola, which is just an astonishing reason to intervene on children. And therefore, I think what Fauci shows is those people who are advisors really need to understand if they stand on the altar of certainty, at some point they'll get their comeuppance, and it's a real problem. And those people who come in and ask questions, reflect on certainty, are the ones you really want to listen to, but actually you might not like what they say.
Do you think if a committee like that was set up and Patrick Vallance found himself on the stand, that he might find it quite difficult to justify some of the claims he made in 2020, 2021?
Yeah. And I think in the hindsight, I mean, what we saw with Fauci is, I think, which also really undermined Fauci, was the fact he's got a congressional pardon and then still took the Fifth Amendment. He made a statement and then said, look, I'm not telling you anything. I'm not prepared to answer anything. I just want to get out of here with almost not going to jail and my reputation slightly intact. Well, actually, I think it's had the opposite effect. I think in the light of day, I think some of the people would take the Fauci approach and think, I'm not answering anything. I'm just going to get out of here and hopefully survive it. But I think you would find a number of the advisors would reflect and start to realize that the tide has turned, if you like, and that actually they've made statements that were not backed by evidence and offered too much certainty and were incorrect. In doing so, we would learn much more about how to operate in times of panic and how to operate in times of great fear, and not fall into the same traps again, where when you know what it's like, if you're fearful, you're anxious, you're stressed, it's nice to hear messages from confident, certain people like everything's going to be okay. But actually, what happens when they're telling the truth or they're misinforming you? That actually we don't know whether it's going to be okay. We don't know that actually we're telling you a rule of 6, but actually 5 foot, 7 foot. What's the difference? There probably is no difference. Now, this is the issue for the UK. We've wasted 200 million on the inquiry. We should have not. It's been a waste of money. We should actually think about the structures of government. A Senate hearing committee that actually really try to get to the truth, I think is important for the public and transparency.
Well, Carl, if they do set up a committee like that, I'll do my level best to get on it and be one of the people asking questions. Thank you very much for joining us.
You're welcome.
And that's it for this week's episode. We will see you again next week. Thanks for joining.